So if you're anything like me, you've had these moments, whether it's in the winter, in the summer, sometime going from somewhere really cold into somewhere really hot, and your glasses have left you completely fogged up. I know I've tried everything, even walking backwards into rooms, I heard helps. If you walk backwards into a room, your glasses won't fog up. I have yet to verify if that's 100% true or not, but I will tell you it makes you look really strange walking into rooms. This isn't the only problem us glasses wearers have. So if you have contacts, you'll know the pain of getting something under a contact or trying to make sure it's clean enough. It's just a struggle. I know up to about 50%, right?
Yes.
Of the population wears either glasses or contacts or has some struggle with their vision. So if you are a glasses wearer, you are not alone. And you're not necessarily at the end of the road with it either.
Correct.
So that's what we're here talking about. We're talking options. So what are the options of getting rid of those glasses, getting rid of those contacts, and moving unencumbered through your life? So we have the expert here with us, and he's here to answer your questions. So if you have any questions about LASIK eye surgery, about corrective eye surgery in general, feel free to ask. So we'll bring your questions directly to him. Comment in the comment section below. We want to hear your questions. And actually, let's just kick it off. Warm up those fingers a little bit and let us know if you are part of this 50% of the population that wears glasses or contacts. And let us know when it started for you. For me, I got my first pair of glasses when I was 11, just in time for that awkward stage of life. But,
most people.
Yeah, it's perfectly timed with that, but it isn't the end. So if you can just give us a little bit of a feel of who you are, about what you do, and especially what this can mean for all of us.
Sure. So I'm Dr. Hwang. I'm a cornea refractive surgeon at Loma Linda University Eye Institute. So I received training in ophthalmology and did additional training after my ophthalmology residency in cornea and refractive surgery. So today we're talking about laser vision correction, which could be life-changing for a lot of people, especially when you are wearing glasses or contacts and you're having trouble either doing the things that you want to do in your life, especially if you want to be active, but when you're trying to do your Tough Mudder in your contacts or glasses, it's kind of difficult. If you would lose it, you are pretty much done for. So if you are interested in being more active, or you are active and you want other options, laser vision correction is definitely an option for you. Of course, any surgical eye corrections has its risks, but those risks are pretty small, and most of my patients are quite happy with their results.
So you don't have to be active, right? I just want to make sure I don't have to go running any Tough Mudders to make sure I qualify for this procedure.
Correct.
But how would I know? So I've worn glasses since I was 11. All I know is that they sometimes annoy me. How do I know if this is something that could help me, if this is something I'm qualified for,
Yes.
maybe I'm too tall for it? What is it that you take into consideration with knowing whether or not this is the procedure for someone?
Sure. So best candidates for these procedures are people usually in their 20s, early 30s, before presbyopia, which is kind of stiffening of the lens inside the eye. Typically happens in patients in their 40s or so. So younger population, typically more active population, but yes, you could be a more sedentary population, but still be okay. And ideal patients are typically very healthy without any eye problems or medical problems. They don't use any eye drops or other medications that could interfere with healing, like autoimmune conditions or eye drops that could interfere with healing. And most patients have had their refractive kind of error or their glasses or contacts prescription kind of stable for a long time. Typically, it needs to be stable for at least a year since you don't want your prescription to be changing again after you get laser surgery or other vision correction surgery.
So now I know everybody when they come and they're thinking through this process, and I'm sure you have some of these questions too. And remember, ask your questions, and he'll gladly answer those specifically. There's all sorts of considerations that somebody has going through their mind. Can I take the time off? Is it worth the cost? I know one of the ones that's at the top of my mind is the concept of surgery and eyes, because I really like my eyes and I really like seeing. I don't know if you guys are the same way. Even if it's with those obnoxious glasses, at least I'm seeing.
Yes.
But can you just like walk us through a little bit of what this procedure actually is?
Okay.
Just to make sure that you're not taking out my eyeballs and running them through a machine and putting them back in,
No,
because I'm not sure I'm up for that.
Yes. So LASIK is what most people are kind of commonly familiar with. LASIK is laser in situ keratomelasis. Basically, it's a fancy word. Basically, what we do is with one laser, this is the cornea, which is in the front part of the eye. With one laser, we make a thin flap, and we lift the flap up, and then we use a different laser to reshape the cornea, and we put that flap back down. So that's the most kind of common procedure we do, LASIK, and we do that because that flap kind of acts as a bandage and it keeps the eye comfortable. And so the recovery time is typically fairly quick for patients who had LASIK. So most patients, even one day after surgery, they could see quite well. And most patients recover within a couple of days, and they're driving, going about their lives. Of course, there will be some signs in their eyes that they had laser surgery, but most people are not really bothered by it, and they take eye drops for about a week or so, and usually that's the recovery period. And most people, after laser surgery, their prescriptions are zero. They see 20/20. I say about 90% plus people see 20/20 shortly after surgery, and that stays for a while. There are a short few, depending on the degree of treatment. The more kind of prescription error that you have, the more tissue needs to be treated and more kind of reshaping has to be done. And the more we treat, the higher chance that it could not end up where we want it to be. But those are far and few between. So most people do quite well with the LASIK. Some people also who are not qualified for LASIK ask, are there other options? So different type of laser surgery is called PRK. PRK is photorefractive keratectomy. So what we do for PRK, instead of making a flap in the cornea, there's skin that's covering the outside of the cornea, and we kind of remove that, and then we use a laser to reshape the cornea. So for PRK, patients need to wait a little bit for the skin of the eye to heal back. It takes, for most people, about 5 to 7 days, and it could be a little bit uncomfortable, but we keep people more comfortable with eye drops or medicine by mouth to help control the pain. And typically those patients, they recover 80 to 90% of their vision within the first week or so, 90 to 100% within the first month or so. And if you compare LASIK and PRK down the road, the outcomes are pretty equal. So it depends on the lifestyle. I usually tell patients who are more active, maybe you're more inclined towards PRK. If patients are not as active and they don't have as much risk for kind of eye trauma, then they could go for LASIK. Okay.
Okay, so we're getting comments and questions coming in, which is always very exciting. So real quick, Molly is joining us and watching. She says she was part of that 50% population, But then she got LASIK and it was the best decision ever. So she is at least very happy with
Yes.
it, which bodes well for some of the rest of us. JJ and Juanita actually have some similar questions here.
Okay.
So JJ said he saw an advertisement for $129.99 per eye.
Okay.
Yeah, should I go there? And what makes your LASIK better? So apparently you have a LASIK, so that's exciting. And Juanita also asked along the same lines, is it expensive to get laser? What about if you don't have insurance? Does insurance help? And what are the risks?
Sure. So most places, most reputable places charge, I say about 1,000 to 2,000 per eye. Usually those places have mostly updated lasers. Those lasers, they cost to maintain. The staff needs to be trained. So if you're looking at some place that's telling you 129, I would be very, very cautious when you go in there. And you should ask specific questions about the type of laser they use. Maybe talk to patients who had it done with them, and if they're happy, how long they've been doing it, what's their training is like, things like that. So the cost, I mean, in the long run, most patients of mine tell me, because they spend like $500 to $700 per glasses, and they get a new glasses maybe, every couple of years. So they tell me the cost kind of, it kind of washes itself. It's actually cheaper to have LASIK now. I mean, especially if you're younger, in your 20s or 30s, because you don't have to buy glasses pretty much, hopefully, for the rest of your life, and you don't have to deal with them. And because it is still surgery, it is still eye surgery. Some people think, oh, it's just laser surgery, no biggie. But it is still real eye surgery. We still have to reshape the cornea, and there are risks to eye surgery. It's small, and most people do very well, but risk of eye surgery, infection, in any surgery cases, infection, decreased vision. Some people complain of dry eyes after laser surgery, halos, driving at night, things like that. They're not particularly common, but some people it's enough that some people tell me, oh, it's not as what I expected. So you have to be aware of all the risks of eye surgery, and you need to talk to your doctor if you have any other factors that could impair healing or other problems that might arise after the surgery.
So speaking of whether or not this is right for you, and in consultation with your doctor, figuring who really is going to be the one to help answer some of those specific questions, because it really depends on every individual patient. But Christina has an interesting question that I hope you understand, because
Sure.
it's not quite as clear to me. But she says presbyopia. Does that definitely rule out someone for surgical correction? And also, I would like to add in the question, what is that?
Sure.
Just put that out there.
Yes. So presbyopia, everybody has to deal with it. Okay, presbyopia is a natural kind of aging process inside the eye of the lens. So the lens inside the eye, so that's the cornea, the lens sits inside the eye. Okay, so the lens inside the eye gets stiffer as we get older, and the muscles that control the lens when we're younger, that muscle kind of changes the shape of the lens inside the eye, so we could see things up close. When we get older, usually 40s, early 50s, the lens inside the eye as well as the muscle don't work as well. And if they don't work as well, then you can't kind of change the shape of the lens to see things up close. So what happens in a lot of people who get LASIK are nearsighted. So if you're nearsighted, you take your glasses off and you could see things up close. So if you get LASIK and you get rid of all that, you are kind of emmetropic, or you see perfect at distance. So if that happens, then your eye, the lens inside the eye, has to work kind of extra hard to focus things up close. So when you get older, if you can't focus things up close, then you need reading glasses. So that's why when your grandparents or your parents wear reading glasses, because they develop presbyopia. So for some people, they really hate that, and they don't want to deal with wearing reading glasses. I'm paying all this money for LASIK. Why do I have to wear reading glasses? So one of the options is called monovision. So some people choose to do one eye for distance, the other eye for near. Okay. Not everybody's able to do it because your brain has to be able to kind of put the two together to do monovision. Okay. And even if you do monovision, most kind of DMV or states require you to wear correction in the other eye so you could drive and pass the driver's test. So that's one option. Or there are other surgeries that could help preserve the muscle inside the eye or the function inside the eye more so than other type of surgeries. Yeah.
So I have to say, with monovision, it already sounds like people will turn into superheroes. It's like, this eye can do that, and the other eye can see here. And it just kind of lends to this concept that's in the back of my mind that laser eye surgery is going to somehow give me laser eye vision. But I don't think you promised that yet, right? Maybe in a couple of years.
Maybe.
We'll get there. But I think what I heard, like what I take away from what you just said is that while this does help a lot of things, it doesn't help everything.
Correct.
And especially not everything at the same time.
Correct. So there's no technology available that could do everything perfectly.
Right.
There are limitations to what we could do. Yeah.
You're going to have to start working on that.
Yeah.
Find a solution that can fix everything
Yes.
at once. So now Irma is very to the point, and I love this question, Irma. Thank you so much. She says, how painful is it?
Okay. So LASIK is not very painful. Most people, they're pretty happy. Just right after surgery, it's a little bit light sensitive. I usually tell them, go home, take a nap, keep your eyes rested, and then next day they're quite happy because they could see 20/20, 90% plus. So PRK, on the other hand, they're a little bit more kind of uncomfortable. Most of the time they say, yeah, it's a little sore, but it's not too bad. Rarely they need extra kind of pills for pain control. But for the most part, LASIK, I say almost painless. PRK, a little bit of pain. But I say 99% of my patients say it's worth it, totally worth it, because they could wake up in the morning and then they see the clock across the room, which they've never been able to see before. And I recently had a patient who come in and they said, I forgot that I don't wear glasses anymore, and they try to take their glasses off when they go to sleep, but it's not there. So they were just kind of surprised by it.
That sounds worth it, even if you're
Yeah.
feeling at your face, not having to take that off. Now we have a question from Michelle who touches on something we mentioned a little bit earlier, but we
Okay.
want to reiterate. And just a reminder, if you have questions, we're answering them. So ask any questions you have about LASIK or corrective eye surgery. So Michelle asks, I'm a single mom of 2 and I'm concerned about the cost. Will I save enough money over time from getting LASIK compared to the cost of glasses and contacts?
Yes.
And I just want to give a little bit of context to this. I'm a little curious, how long does this last? Because when we're comparing prices, if I
Yes.
think 5 years worth of glasses or a lifetime worth of glasses, it's going to balance out a little different.
Yes. So it depends on what age you get the laser surgery done.
Okay.
So if you're in your 20s, early 30s, you could last till your 50s when you start developing cataracts. Okay. If you get it done in your 40s and you're already developing presbyopia, maybe a little bit early cataracts, and you have family history of cataracts, maybe it'll last for only a few years. So usually if you're a younger patient and you have a high prescription or astigmatism or kind of different shape in the lens and you have to pay extra for those glasses or contacts, then in the long run, it'll save more if you're a younger patient.
Okay. Now, I'm going to come back to you, Myra, with your question because I think it'll take a little bit more of an answer. But real quick, Irene asks, what's the average age of patients who get this surgery?
So I will tell you, most people are in their late 20s, early 30s, although recently I've seen some people in their kind of early 40s being more interested in it. But they are presbyopic, like you mentioned earlier,
Right.
where the lens inside the eye is not working as well to bring things up close. So they need to be aware of needing to wear reading glasses even after laser surgery. Okay, unless you want to do monovision, which is one eye for distance, one eye for near, which not everybody's able to do.
Great. Now, Myra, coming back to your question, says, I have lazy eyes, aka strabismus.
Strabismus.
Okay,
Yes.
thank you. She's had this since she was born. Without surgery, is there any other way to fix my eyes?
Fix strabismus? Or
Yes,
usually
I think. Or can you have LASIK with strabismus?
so typically
We'll answer both of those
yeah.
questions and figure
So-
out which one.
So
you needed.
typically strabismus is corrected with eye muscle surgery. So there's really no good way to correct the alignment of the eye, especially if you had it for a long time without surgery to correct the alignment. But it also depends on if the strabismus was caused by refractive error. Okay? So if there's a prescription error that causes strabismus, especially if you're kind of younger patient, maybe if that's corrected, they could realign it on its own, but highly unlikely. So most likely strabismus needs to be corrected with surgery,
Okay.
eye muscle surgery. But if you have strabismus, a lot of people also have amblyopia or lazy eye. Okay, their eye didn't develop perfectly, so they can't see as well out of that eye. So, and there's also different degrees of amblyopia. So if you have mild amblyopia and with glasses you're able to see, 20/30, 20/25, not quite 20/20, but you're almost there, then maybe you could do laser surgery to kind of get rid of, but it won't be better than what you have now. You'll end up where you are now, just without glasses. But if you have other eye problems that limit your vision, then laser surgery really won't do much more than what you wear with your current glasses or contacts.
Okay, so hopefully that gave a little bit of a context and some answers for you. We have a question from Molly, who earlier we found out had LASIK done, and she says it was about 10 years ago. She says she likes to swim. Well done, Molly. That's a wonderful exercise to participate in. But she's been worried since she had LASIK about opening her eyes underwater. So can she do that? Will water get under the flap and cause eye problems?
So typically, I tell patients just right after surgery, about a month after surgery, they shouldn't go into water because it could affect the healing process. But after that, usually if you're 10 years out, it's well kind of sealed in. So you shouldn't have any limits in your activity usually after first month or so if everything is healing okay. So I wouldn't really worry about your flap, Molly.
Okay, your flap is fine. All right, good news for Molly. Now, Amanda writes in, and she is a nurse. Wearing glasses is a pain, especially when she needs to wear a mask and can't push them up during the procedure.
Yes.
And I sympathize. She says, unfortunately, she doesn't think her insurance helps with the cost. And do you have any advice for someone in this situation?
So, LASIK is typically not covered by their insurance unless like you have really good insurance because it's elective surgery. So it's not medically necessary. It's by your choice or your lifestyle that you want to try to get laser refractive surgery. But there are options. If you have an FSA account, you could use your FSA account, the money that you put in there to pay part of the LASIK cost, or there are other kind of vision plans that you could get on. They give you like discounts on some provider, like specific providers that they contract with. There's also kind of care credit or kind of financing companies that could help you kind of spread the cost of the surgery over how many ever months that you want to spread that out for. So there's definitely options. I would talk to whoever your provider is and come to a kind of agreement, whatever works for you. But there's definitely options. Yeah.
Okay. Now, the next question is one that I resonate with because I hear this so often that I feel like I should know the answer. And I'm sure I've been told the answer a million times, but I never remember. So the next question, what is astigmatism?
That's a very common question. Okay. What I typically explain to patients, astigmatism, the shape of your eye or your cornea is shaped more like a football compared to a basketball. So in a basketball, it's nice and round, but football, it's this different kind of angle in different meridians. So you need a special type of kind of correction in your glasses to get all those light focused onto one point. So most people have mild astigmatism, so some people don't even notice they have astigmatism. Other people with a lot of astigmatism, they need either contacts or special type of glasses to get a full correction in their vision.
Okay, so if I have astigmatism, which maybe I have because I don't remember what doctors tell me when I go in for my glasses, am I still a candidate for LASIK eye surgery, or is that something that means I have to look for a different option?
So the astigmatism in itself doesn't necessarily preclude you from getting LASIK. Okay? But some people have a lot of astigmatism, and sometimes you worry, is there something else going on? Because we worry about other kind of like what I alluded to earlier. If you shave off too much, the cornea doesn't support itself. Some people are more prone to that. It's called keratoconus. So some people with a lot of astigmatism could be developing keratoconus, and that could be a sign of it. So that's why your doctor will do special testing to see if you are developing keratoconus or not. And if you're not, and you have mild astigmatism, then yes, you definitely could get LASIK.
Okay.
Or PRK.
So just because you have astigmatism doesn't mean you stay at home and don't ask the question.
Correct.
You can still go in at your next eye exam when you're checking to make sure that your prescription hasn't changed that much. Ask the question, see if they can help you figure out the answer. Which brings me to a little question. To find out whether or not I qualify, is it something I can bring up when I go in for my annual or biannual eye exam? Or is it something that I have to specifically seek out a place where they perform LASIK in order to answer the question?
Yeah, ideally you want to talk to a provider who performs the surgery because they'll know what they're looking for. But if you think that you're a candidate, I mean, one of the things, as I mentioned, is your prescription has to be stable for at least a year. So right away you'll know if your prescription has been changing in the past 6 months and you have to get different glasses, then no, you're not a good candidate. But if you've been wearing the same pair of glasses for the last 5 years and you're seeing very well and you're doing okay, and you want to see if you're a candidate, then yes, by all means, go see a person who performed these procedures and they could do extra testing to figure out if you're truly a good candidate.
Right. And a little farther down, Amanda, our hardworking nurse who always has to push up her glasses, says a quick thank you. I just wanted to make sure you heard that. It's interesting. In my family, my sister, everyone in my family wears glasses except my mother. Why I didn't get her eyes, I don't know. But my sister got LASIK as a birthday gift from her husband, which at the time when she got it seemed sort of ridiculous to her. But my lovely budget watching and hardworking mother of 3 kids found that it ended up being, I think, the best gift of her life. So if we have anyone watching that is considering this as a gift for their spouse or a family member or maybe your child who, as a special gift for performing well in college, then
maybe a little bit older.
Right. Maybe grad school. Then what sort of suggestions would you give? Is this something that you would how would you go about doing something like this? Sending them to the eye doctor and secretly saying, hey, could you let me know if they're, if we're qualified for this, or, because I wouldn't want to get the hopes up too soon,
Yeah.
and then they go in and find out you couldn't have it anyways.
Yeah.
So it's a bizarre question, I know.
That's okay.
But
So-
how would you go about that?
I mean, you could come together to the appointment, and then your doctor will tell you right there, usually, that if you're a candidate or not, and then you could surprise them right there and say, I'll pay for it. And then I'm sure they'll be more prone to proceeding, maybe. So.
All right, birthday gift advice from from your local eye expert. So now we have a few questions that are easy questions,
Okay.
I think. I mean, easy for you, wouldn't be easy for me. Michelle asked, what percentage of someone's eyesight, or what's the percentage of someone's eyesight reversing after LASIK? Can it get bad, and what causes that?
So I usually tell people the regression rate, or kind of the effect of the laser wearing off, is dependent on how much treatment they've had done. So if you are -10, you're much more likely to kind of regress compared to if you're a -2. Because the more treatment you do, the laser has to take off more tissue, and there's more healing process involved if you are taking off a lot of tissue. So you typically tell patients each diopter of treatment, maybe 1% chance that it'll regress in the next 5 to 10 years. So it's not a lot, but if it does happen, a lot of people are able to get an enhancement or retreatment to correct whatever that's regressed, especially if it's been kind of holding steady. So same kind of prescription kind of stability applies. So if it's been a year and you're at the same prescription because the first time you were treated, it didn't get everything, then you could get retreated for that whatever is left over. So typically regression is low, but depends on the degree of kind of nearsighted or prescription that you start with in the first place. And people with astigmatism, which someone has mentioned earlier, typically if the higher the astigmatism, the higher chance, same thing, of regression of treatment.
Okay, now I know I alluded to this earlier by accident when I was thinking of college students, but Molly asked, what age is too young to get LASIK? So what's that point that you would say at this age begin considering?
So for elective LASIK, I would say over 21. I say, but your prescription has to be stable for a long time, like at least a year. Okay. So, but there are special cases where you could treat younger patients.
Okay.
If there's some centers with patients with small children, if they're developing amblyopia or problems because their prescription is so much, and the kids can't wear contacts or glasses because they don't want to or they can't cooperate, to save their vision, you could do laser refractive surgery. But that's special cases. So I tell people usually 20s, young 20s. I say after 21 and up.
Right, so in those cases, they're not ones that you're asking for
Correct.
necessarily.
They're medically necessary. It's
right.
different case. So elective LASIK or elective laser refractive surgery over 21.
Okay, that's really interesting to know because I've heard of cases of children that have had the surgery, but when it's medically necessary, that
Correct.
makes sense. All right, Daniel has a question about diabetes. So he asked, what is your advice for a person with diabetes with probably future eye problems?
Yes.
And is LASIK an option? Does the diabetes get in the way? Does it change their eligibility at all?
Yes. So diabetes is what I would call a relative contraindication. Depends on the control of the diabetes. If you have other problems because of diabetes, if you are under well-controlled diabetes, you don't have any other problems, your doctor that you see every year for a routine diabetic exam says there's really nothing going on in the back of the eye, and you haven't had any healing problems, then maybe that you're a candidate. But because diabetes in itself causes delays in healing, there could be problems. That's why it's a relative contraindication. So you got to talk to your doctor, you got to talk to your local refractive surgeon and decide what's the best course for you. Because diabetes, there could be other problems inside the eye that could develop in the future, even if you get LASIK. So, case by case.
Okay, so that's a good reminder that when you're giving your medical history, even if you're thinking, well, why would my doctor need to know about my blood sugar
Yes.
levels? It can be a very important piece of the puzzle that they're
Correct.
needing to figure out.
Yes. Medications we have to know that could impair healing, other eye conditions, other medical conditions, especially if it has if it impairs healing or autoimmune conditions that could cause problems after the surgery.
And that's a good reminder for me because I'm always the person thinking, why would this doctor need to know that? But chances are
Yes.
they need
We
to
need
know
to
a
know,
lot
yeah.
more than you think
Yes.
they do. Now, Patty asks, do you still use a blade?
So there are different centers used. So someone asked the question if 199 Ni is a good idea. So if they're using a blade, then they may be kind of cutting the costs of using the extra laser to use a blade. I mean, blade has been used for a long time. There are still some centers that uses it. For the most part, they've developed it so that it's quite safe. But personally, I prefer my technique of using different laser, a femtosecond laser to cut the flap, and then using the excimer laser to reshape the cornea because of the predictability of the outcomes that I get.
Okay,
But
so-
there are different people with different points of view
Right.
that still uses a blade versus the laser.
Right, so in your procedure, you're all laser based?
All laser based.
Okay. And just out of curiosity, does that help with precision? Does that help with recovery time? What's the advantage of using a laser over a blade?
So less complication with the laser compared to a blade because you could control it much more kind of precisely. If there's movement, you could abort it immediately instead of a blade coming through. It's hard to stop a blade from going across the eye. So for me, it's more predictable outcomes. But there are some colleagues on the other side who would disagree with me.
The things I've never stopped to consider.
Yeah.
Well, I know this has been really interesting to me. As someone in this age range, in this ideal candidate, look at me, I'm thinking I'm ideal. I might not even be qualified. Imagining myself as the ideal candidate for this procedure, I think that's really kind of put me at ease with a lot of this. And I hope it has for some of you as well.
Yes.
Just remember, if you still have questions looming in the back of your mind, go to an expert and ask.
Yes.
I don't think you've probably never gotten annoyed by somebody coming in with questions and
Correct.
trying to figure
I'll
out
answer
if
every
this is
question
it.
that you ask.
Right, so
And heard all of them too. Yeah.
so no question is too silly, no question is too basic. Let an expert sit with you and really talk through it, because when it comes to taking care of yourself and giving yourself the best opportunities out there, 30 minutes of conversation isn't going to be too much to make sure that you're
Yes.
feeling confident
Yes.
and feeling ready to choose.
Yes.
Either way, whether you choose to have it or choose not to.
Yeah, most people are very happy with the outcomes of surgery. So if you're considering it, I would at least talk to somebody, talk to an expert.
Perfect.
Yeah.
And start imagining your life waking up, reaching over, and there's nothing there you have to put on your face. And there's nothing there for your children to rip off of your face, or somebody